Welcome back to TV5 News at 9. Congress is discussing cutting Medicaid with recent legislation. Joining us this morning to tell us more about the impact on Michigan families, we have Laura Apel. She's the Executive Vice President for Michigan Health and Hospital Association. We appreciate you being here.
Thank you.
So much to talk about. Let's start with what the Michigan Health and Hospital Association is really, and also how it works hand in hand with Michigan hospitals.
Terrific, thanks. Yes, the Hospital Association represents all of the hospitals in Michigan, and you could think of it as the Chamber of Commerce for hospitals. So they are our members, and we work to support them in terms of advocating for them at the state and federal level, as well as getting communications out about what's going on that affects healthcare.
All right, and what are some of the biggest challenges that Michigan hospitals are facing right now?
So hospitals are always trying to manage costs that are increasing fairly dramatically, costs of supplies, costs of equipment, even the cost of labor, which, as we all know, we've had a significant labor shortage for a while, especially related to nursing. And at the same time, more than 50% of reimbursement to hospitals come from government payers, which are generally preset amounts. And so even contracts with other insurers that you would think of, like Blue Cross Blue Shield of Michigan, those contracts are done for 3 years. So if you did a contract for 3 years out with small increases in reimbursement, and yet inflation is at 8, 9, 10%, it makes a very tight financial situation.
All right, well, let's talk about these, proposed federal Medicaid cuts. What will this mean for hospitals and really healthcare providers, I guess particularly in rural or underserved communities?
So it probably might be surprising to folks that we have a higher percentage, not a higher number, but a higher percentage of people in our rural communities who use Medicaid as their insurance coverage than more urban or suburban areas of the state. About 40% of rural folks need Medicaid, either for their nursing home services or for their general health services. And making cuts to the Medicaid program, we don't make this prediction, but the Congressional Budget Office says that what passed the House earlier today would remove more than 7 million people off of Medicaid nationally. So that's about 10% of people who use it. If we applied the same number in Michigan, we're looking at 250,000 people or slightly more potentially losing their coverage over time.
Wow. Now, what consequences would Michigan families face, especially children, seniors, people with disabilities, if all of this moves forward?
So when we reduce the amount of coverage, we reduce the amount of reimbursement, which it makes it that much more difficult for organizations to keep beds open, keep the staffing levels that they need. It could cause shortages. For example, we already don't have any excess or surplus in nursing home beds. Also, when parents lose their coverage, they tend not to be able to keep their kids covered, and so kids might drop off of the program even though they remain eligible.
A lot of people wonder, oh, will this impact me? Can you speak to really the broader economic implications of these proposed Medicaid cuts? And that includes, jobs, strains on the state's healthcare infrastructure?
Yeah. We anticipate that the state legislature and the governor will have to find more general fund dollars to support Medicaid because of the federal cuts. We also know that, especially among rural hospitals, but all hospitals, there are certain services that are very expensive to offer. Labor and delivery, giving birth in a hospital, that labor and delivery service is requires a lot of staffing. And physicians, midwives, nurses, etc. So if Medicaid is unable to pay its share of the cost, that endangers the ability of an organization to offer that service at all. If a hospital has to close, for example, its inpatient psychiatric care or if it's labor and delivery, then that service closes for everyone. It's not going to matter what insurance card you have in your pocket. If your hospital can no longer manage the cost of delivering babies, that service ends for everybody, not just people with Medicaid. And the same thing is true with any service line that would have to be discontinued because there aren't enough resources to pay enough staff or, pay for the overhead that it takes to have something like that offered at your local hospital, your community hospital.
And families and people who are concerned, should they contact lawmakers?
Sure. So the U.S. House of Representatives passed its bill this morning. I would still encourage people to reach out to their member of Congress, their House member, but also to let their U.S. Senator know how significant this would be. Medicaid is the largest payer in our state for nursing home services, for inpatient psychiatric services, and for labor and delivery services. And that goes across the continuum of folks, like you were saying, people with kids, people with disabilities, people who are elderly. All three of those major areas, I think, would have some difficulties if this bill passes the way it goes to the president in the way that it passed the House.
All right, well, thank you so much for being here. If you want to learn more about this, you can find the information in that hot link section at the top of WNEM.com. We are back in just a moment.